I'm talking with Dr. Sam Kim. He's an emergency department physician at Maimonides Medical Center, which is the largest hospital in Brooklyn. And he also works at some local community hospitals. Dr. Kim, thanks so much for being with me today.
Yeah, thanks for having me.
For starters, we're now pretty deep into this pandemic, into this health crisis. How are you holding up?
I'm okay. It's becoming, more of a marathon stretch.
Can you tell me a little bit about why this disease has been such a challenge, in the sense that a lot of people thought that it was going to be like an intense version of the flu?
So I think, myself included, when all this started, we thought that, this was just going to be another viral season, just a new one, that would be busy for a while and then would teeter off. But what we're seeing is that, one thing is it's so transmittable. It's so easy to transmit to others when someone is sick. And another part of that is that people can be feeling well without any symptoms and still transmitting the virus without realizing it. What's so different about this virus and so unique is that it's affecting everybody in such different ways, and the way that we're used to treating somebody who gets very sick from even the flu or from a pneumonia or from, any other infection. Some of those conventional strategies we're finding they don't work as well with people who are very sick with coronavirus. And right now there's no uniform agreement or, clear understanding of this disease process.
So has this been like a scramble, a mad dash to figure out how to treat this thing? Are you guys kind of figuring this out to a degree as you go along?
So, when we first started seeing all these patients coming in sick, you see these numbers, especially the oxygenation numbers, what they're saturating. So, you see that someone's oxygenation level is much lower than they should be. And traditionally, this makes you, very concerned about the patient. This makes you want to be very aggressive about providing them the oxygenation that they need. The peculiar part has been that these patients, usually when you see them, saturating at a level of 70s or 80s or even lower than that, we're used to seeing them in distress. That's what makes sense. And
70 or 80 out of 100.
Yes. So normally healthy people should be setting, 95 and up. And we're seeing, even healthy people who don't have much medical problems. And when they're, saturating low like that, you expect someone like that to be in a lot of respiratory distress. You expect to see them complaining they can't breathe. And you see that, this is what we're used to seeing. And these patients were used to, putting them on respiratory support or even intubating them in order to help them breathe. The peculiar part about coronavirus is that, these patients who come in with suspected COVID, we see them looking okay. We see them breathing. The numbers are off. It's confusing us. And we're wondering how aggressive we need to be at that moment. But the patient actually looks okay. And they're telling us, they're a little tired or they're a little feeling unwell, but they're not really complaining of this difficulty breathing. And that's very unique. That's very different from what we're used to seeing. And it makes us take pause. And, there's a lot of studies out there right now. There's a lot of anecdotal evidence that this may be, more than just a one-sided pathology. It may involve, abnormalities in your blood and your hemoglobin that may be causing this. The lungs that we're seeing, the physiology of these lungs look a little different from what we're used to seeing in a lot of these patients. So the strategies end up changing to see if we can improve on the outcome of these patients. What we're seeing early on is a lot of these patients that end up intubated and on a ventilator, they don't do so well. And part of it may be that they're already very sick. But the other part, that makes us, explore all these other options is to see if there's any way to improve on the outcomes on these patients getting better, at least until we figure out the best protocols on how to manage these ventilator settings once these patients are intubated to, prevent any harm.
Is there any determining how a patient's going to do when they walk through the door?
I think that's the challenge of treating this whole thing, is you never know whether this patient is going to be fine on the oxygen you're providing them, if they're going to get worse during your shift, or if they're going to get worse over the next few days.
What does this all feel like from your perspective as an emergency doctor?
So if it wasn't so morbid, if people weren't getting so sick or hurt by this disease, I would call it fascinating because it's so unique. It's nothing like we've ever seen before, and it's affecting the body in such a profoundly unique way that we don't have a perfect grasp on yet. And honestly, on my days off, I'm obsessed with this disease. I'm reading about it. I'm reading what other physicians are saying about it because we're all seeing the same things. We're all noting the same paradoxical things that we're seeing, and it's something that I'm hoping that we're all gonna get on the same page and figure out.
What's the emotional toll been like for you?
So I've definitely um, had heavier days during these past couple of months. They've probably been the most challenging couple months of my medical career. I can say that for most of my colleagues as well. I think all of us will be affected by that in the long term. Over time now, I have seen a few patients who were young, who were in their 30s, who didn't really have chronic medical problems or anything like that, who looked okay when I first saw them, and who required some oxygen, but they were breathing okay. Their numbers were reassuring, and over the course of a few days, we did see some of these patients get worse. Patients I'm not expecting to see that in.
These are patients like you and me.
Yeah, that's the part that really hit me pretty hard. They're previously healthy patients. Now that being said, most of us are going to be okay. Most of us are going to have this viral illness, and our breathing status won't get worse, and we'll bounce back okay. But I have seen a few that that'll definitely stay with me, that I've seen before my eyes, them looking worse day by day, and to the point where they end up needing to be put on a ventilator, and some of them have even died. And that's the part that's, I think, scary for the general public, as well as for the physicians and the medical staff that are taking care of them. At some points you feel like you've done everything, and it's heavy when you see something like this happen.
I can't imagine what that must feel like and what kind of a toll that must take on medical staff.
In this time, we've been seeing almost all COVID patients. And these are patients who are otherwise have been doing okay and who are awake and talking to you and telling you about their symptoms, and patients that you're watching over hours. This is not something that you start a treatment and that they're stabilized and that they're going to be okay and you can move on to the next patients. These are patients that you're watching over and over again, walking by their bed and seeing how they're doing, nursing them. They're having these horrible high fevers and night sweats, and you're wiping away their sweats overnight, showing them how to position themselves to breathe better, and watching them either get better, or many of them you're watching them get worse. And when that happens, by now you've bonded with this patient over hours. You've spoken with their family members. I'm even FaceTiming them on my phone for them so that they can see their family if they can't come to the ER. And by the time they get worse, it's definitely a heavy feeling. You definitely feel the weight of that. My biggest priority for these patients, besides providing them the care, has been to get in touch with their family member or ask them if they want to call anybody. Some of them I've even wheeled these patients by the door so that they can wave and see their family member. And kind of the heartbreaking thing is, and the reason I'm prioritizing this so much is I don't know which of these patients are going to do worse, and I don't know if this is possibly the last time that they'll be able to talk to their family member. And I think that's such a huge difference and a challenge of treating COVID, this helplessness that the family feels, that they're not able to all be there at the bedside with the patient. And even some of these patients that have died, their family members have called in to say that made a huge difference, to be able to at least talk to them one last time or see them. I think it's so important to maintain at least this human decency part of everything. And remember to be a human at the end of the day, besides just being the medical team.
Right now, what scares you the most?
I think we're in this for the long run. I don't see this going away anytime soon. And what scares me is that eventually I think someone is going to decide that, this social isolation thing, um, needs to stop. And people are talking about the economy suffering, and I totally feel for that. The whole purpose of this was to be able to take care of these sick patients as they came in so that we don't run out of resources, so that we don't run out of the capability to be able to treat these patients. So that still scares me the most, that, um, you know, if this doesn't continue to be taken seriously, we're going to, again, be caught off guard, and we're going to be running out of resources again if, people don't take this seriously and everyone gets sick all at once again. The big hope that I have is that over time, seeing more and more cases and treating more and more of these patients, that will, come to an agreement on the best strategy and the best management strategy for this. Um, and that's what I'm hoping for, that we'll continue to improve on these numbers and do the best that we can for our patients. I'm lucky at a place like Maimonides where, everyone's on the same page, everyone's trying to do, has been contingency planning, and we have the resources. I will say that some of these community emergency rooms that I work at, I have seen a difference in the amount of resources and support that they're getting.
Oftentimes, those community or rural hospitals are the ones that are already understaffed, under-resourced, and they're also taking care of the most vulnerable people in their communities.
The community ERs, their staff is also, you know, putting forth heroic efforts to take care of all these patients. But some of these hospitals are so much smaller and, not used to this type of overload. So that concerns me about how not just in New York, but throughout the rest of the country, how these community or rural hospitals are going to deal with COVID if they, get a bunch of sick patients all at once.
Well, Dr. Sam Kim, I really appreciate you taking the time to talk with me today. I will be thinking of you, especially tonight when we do our 7 p.m. round of applause for healthcare workers.
I appreciate that. Again, I have to say thank you to everybody out there, to our city and New York City and the rest of the country. Everyone has been so supportive, and, um, everyone seems to be taking this seriously. So I would say thank you so much for that. Thank you for the support you're giving everybody. And, please continue to do your part and to take this as seriously as you can.
Thank you. We will. Please be safe, and we'll talk again soon.
Okay, sounds good. Thank you so much.